for joining us for In the Know podcast series. My name is Nirmala Pereira, and I'm your host today. I'm the social media coordinator for the IOC World Conference on Prevention of Injury and Illness in Sport. Also, I'm a member of the Sport Without Injury program at Linköping University. Currently, I work as a clinical research project officer at the AIS. Today, our guest is a well-known sport physician and a wheelchair racer, Dr. Cheri Blauwet. Welcome to the podcast, Cheri.
Thank you, Nim.
You're a Paralympian. Can you give us a snapshot of your colorful career?
Sure. Happy to start with that. So yes, my entry into the world of sport was as an athlete. I started to compete in community-based adaptive sports when I was a teenager. And then after trying many different things, really fell in love with the sport of wheelchair racing. By the time I was going to university, I was starting to gain skill in the sport and really wanted to sort of see how far I could go competitively. So I went to the University of Arizona, where I really had increased access to coaching and daily training with some really excellent athletes. And when I was there as a student, I qualified for my first Paralympic Games in Sydney. In Sydney, I competed in shorter distance and brought home 1 silver and 3 bronze medals, which was pretty awesome. Moving on from there, I competed in 2 more Paralympic Games, Athens 2004 and Beijing 2008. And over that span of time, actually evolved into doing more middle and long distance racing. In the sport of wheelchair racing, athletes are more likely to cross over into different distances because it's a mixed anaerobic sport, and drafting is very much a big part of the sport. And so even if you're an endurance athlete, you still have to have a lot of speed. And so although I started with short distance, evolved into long distance and marathoning as well. So I competed in Boston 4 times, won the women's wheelchair division in 2004 and 2005. Made me fall in love with sport and know that I wanted to dedicate my career to sport.
You're also a medical doctor, and you've taken many leadership and advocacy roles. Can you tell us a little bit about life after racing?
Of course. So when I was winding down my competitive career in wheelchair racing, I was already really thinking about, what comes next in terms of my post-competitive career. I knew that I wanted to stay involved in the Paralympic movement because it felt like it was such a part of who I was and really, part of the fabric of how I wanted to continue to shape my life and career. After Beijing in 2008, I retired from competing and then moved on to my medical residency. And shortly thereafter had a really great opportunity, and frankly, I think had a really lucky moment where I was asked to join the International Paralympic Committee Medical Committee, initially as the athlete member and then evolving into being a full member. And through that work, began to really, understand the role of the medical committee. Through that time, worked with, many fantastic colleagues from around the world to launch some really important projects, like, for example, the Paralympic Injury and Illness Surveillance Study. We began to do a lot of work in standardizing medical services across Paralympic events and creating education and raising awareness about athlete health within the Paralympic movement. And so for me, all of that work was very transformative because it really shaped how I wanted to dedicate and contribute even within the field of sports medicine. From there, continued to push and continue to network and expand horizons and get to know people in the sports medicine space. I began to get involved with some IOC initiatives, and ultimately a couple of years ago joined the IOC Medical and Scientific Commission, which of course has broad overview of the Olympic movement, inclusive of scientific initiatives like the IOC World Conference. Another important area of work that we're currently pushing is an IOC working group on athlete mental health, which is of course of extreme importance within the sports medicine arena right now. And then from there, as it relates to advocacy, have continued to be involved in thinking about not just sports medicine, but Paralympic athletes and opportunities for para-athletes and expanding opportunities and looking at how we can continue to create equity for these athletes in terms of their overall rights and competitive opportunities. And through that work, became involved with being a member of the board of directors of our National Olympic Committee and National Paralympic Committee, where really, of course, sports medicine and athlete health are of great importance, but the mandate is even broader in thinking about how we grow Olympic and Paralympic sport and optimize our competitive excellence in the United States. So, frankly, it's really been a journey, and I think that it all got kicked off with a lucky break, as so many things happen in life. And from there, I just kept trying to run with it and walk through open doors when they presented themselves and jump into really great projects. And I feel like it's been, a really amazing journey, and with the opportunity to work with just really amazing colleagues from around the world.
Can you share what it was like to work as a sports physician during this pandemic?
So, of course, it's been an extraordinarily challenging time across the world, and certainly here in the US, our part of the country, New York, Boston, New Jersey, really the whole upper Atlantic and New England region have been particularly hard hit. And on a day-to-day basis, in a pre-COVID world, my work is primarily as a rehabilitation physician with focus on sports medicine. But of course, when the pandemic started to ramp up, and when we started to see rapidly increasing cases, it created a total shift across our healthcare system. And one of the primary areas where I was involved was thinking administratively about how we prepare for that, and how we ramp up services in certain areas and pull back services in other areas to make sure that we can meet the needs, the acute needs of the community. So in that sense, we really ceased almost all of our standard sports medicine services, inclusive of things like outpatient clinics, rehabilitation services, physiotherapy, etc. And most of our staff in sports medicine were asked to stay home and to maintain social distancing to the best of their ability, unless individuals were, the term we use is redeployed, meaning sort of repurposed or asked to serve in different roles in order to meet the needs of the health system, which many did. We really revamped everything. We repurposed certain areas of the hospital into ICUs. For example, some of the preoperative areas and operating rooms, which would have been used for elective surgeries, things like knee scopes or shoulder scopes, were instead repurposed into being able to be a bed for the ICU with ventilator capacity to meet the needs of the patients who had intensive care needs. In Boston, we converted our convention center into a massive post-acute facility that had 500 beds, actually 1,000 beds, 500 for post-acute COVID patients who no longer needed to be in a hospital, but also weren't yet safe to go home, where they could, of course, put other people at risk in their home environment. And then also part of those services were also tooled towards the homeless population, where, of course, it would be extremely high risk for someone who's COVID positive and homeless to, continue to be in an unsecure environment in the community. So that was a major shift that helped to serve the needs. Really, it was an interesting time because I think across our healthcare system, all of this stress was really potentiated by the fact that daily life was also totally disrupted. People's support systems weren't with them and next to them. Very challenging, for example, for clinicians and physicians and healthcare workers in general who may have small children or responsibilities at home. So it was a very stressful time overall, but we are now on the other side of it. We reached the peak of our curve in late April, and cases are now decreasing. And we're really now in the phase of looking at how we reintegrate some of those normal services, for example, reopening sports medicine, slowly but surely, so as not to increase risk or create a recurrence of cases or a recurrence of problems. But knowing that at some point we have to get back to our typical workflow. So my first day back in my typical sports medicine clinic was today, and it felt really good to be able to practice sports medicine again after being off for over 2 months. But of course, we did what we had to do in that time in order to, mitigate further spread and ensure that we were doing everything we could to minimize fatalities and preserve the health of the community.
That's great. I'm pleased to hear that the curve is starting to flatten and that you're practicing sports medicine again. We know that individuals with disabilities and chronic illnesses have a higher risk of contracting COVID-19 because of their compromised immune system. What is the impact of COVID-19 on individuals with disabilities and their community?
Yeah, I mean, if we think about the way in which COVID-19 has impacted the community more generally, and from a non-athlete lens, it's had a profound impact on the disability community, particularly those who are most vulnerable. And of course, most of these aren't athletes, right? But rather older individuals with chronic health conditions, potentially living in, supported care environments, elder care, etc. And across the board, it's created numerous challenges and a lot of fear within the disability community. And there's been challenges with people that have significant care needs, for example. A lot of people have been able, even with significant disabilities, have been able to live in their home by having someone, come in on a daily basis and assist with activities of daily living. And a lot of that was cut off during COVID because of the risk of having people enter the home, the risk of having one carer who may go from home to home and care for multiple people within one day. And so that was an extreme challenge because those are, of course, the people who need the support the most, and suddenly it was cut off, which led to a very dangerous situation. Additionally, a lot of people with disabilities have had challenges with things like the medication supply chain and meeting their basic needs to maintain health. And there's also been, what I've observed is a persistent and somewhat unfortunate fear of bias within the healthcare system. I think in its most extreme form, there are some people who think that if they were to contract COVID and go to the emergency room, that they would be seen as having less value because of their disability. So I've seen broadly that people have a lot of fear and reticence to seeking care because they're afraid they may be misjudged or discriminated against on the basis of disability, which I don't think is always the case, but that perception is there. Interestingly, for all these reasons, the disability community more broadly has really actually come together in a fairly tight-knit way and has had a really strong advocacy voice in ensuring that when we think about providing care and implementing services related to COVID, that we don't forget about the needs of the disability community. And that's really been, I think, a silver lining and something very encouraging to see.
COVID-19 forced athletes to find new ways to train. Can you share some examples?
Yeah, I've heard some really interesting examples, and I'd say that on the whole, I think athletes have all responded in really individual ways. Some have really taken it in stride, and others have, really gone through, having to process a lot of pretty extreme emotions, disappointment at postponement at the games, and then sort of adjusting to that new normal and thinking about what it means to have to go another year of training. Some sports have been profoundly impacted and others less so. For example, colleagues and friends and athletes that I work with in sports like road cycling have been relatively, frankly, unaffected. They're still able to do, work on their indoor trainers as well as get out on the road and being able to maintain social distancing while still getting on good mileage and, being able to continue with what they expected as part of their training plan. Of course, individuals in contact sports have primarily been just cross-training in their home environments, a lot of strengthening and conditioning, which has been disappointing and I think difficult for many. Interestingly, I've seen ways that athletes have found to still bring their community together. So, for example, the Boston Marathon, of course, usually takes place in April, and it was postponed until September and actually announced that it would be canceled. But the athletes who were scheduled or planning to compete in the wheelchair division of the Boston Marathon actually, on the day that the race was due to run, got together from all corners of the world and did a 26.2 mile race over Zoom, where everyone was training on their own. One athlete, actually the prior men's division winner from 2019, his name is Daniel Romanchuk, and he led it. And it was just, really, really, frankly, inspiring to see athletes come together like that, and the camaraderie it demonstrated, and the resilience that it demonstrated. I've also seen athletes use humor quite a bit to combat the stress. I've loved, for example, some of the social media coming from outlets like the Olympic Channel, where they show athletes doing things that are somewhat goofy, but keep everybody lighthearted and understand that actually humor is part of resilience. So, for example, an Olympic swimmer getting in a kiddie pool in the backyard and having someone splash water on them and simulating a race. So it's been pretty. I've really seen it run the gamut. Everything from athletes really struggling, feeling quite depressed, feeling quite withdrawn, to some taking it in stride and finding a lot of humor. And what I'd say is that I think whatever athletes' emotions have been, it's okay. Everyone responds differently, and we really need to support people with where they're at personally. And we'll get through it together.
For individuals with disabilities, what will physical activity, more specifically sports, will be like in a COVID-19 environment?
Yeah, I think it's a great question. I think that, it may look a little different whether one's a recreational level athlete versus an elite athlete. I think I do expect a fairly slow return. There are some unique considerations, I think, for athletes with disabilities. When we think about this from the perspective of the IPC, what we're really trying to reiterate is that it's not, there's no one size fits all approach here, because athletes with disabilities it's a very heterogeneous group, and the impact of their disability in terms of risk of either acquiring COVID-19 or having bad outcomes from COVID-19, it's quite different from athlete to athlete. But I think there are some important considerations that athletes will need to keep in mind. So, for example, there are many recommendations coming out with regards to cardiac and pulmonary testing prior to return to play, and certainly prior to intensive sport. And I think that for any athlete with a disability, really the threshold to think about this type of testing should probably be lower, and we should probably be more likely to offer it. Because of the underlying prevalence of things like asymptomatic cardiac conditions. And Antonio Pliccia did a nice paper in BJSM in 2016 that showed that that there is a higher prevalence in a Paralympic athlete population of underlying cardiac conditions that we may not know about, and so we should be even more careful prior to return to elite sport and intensive sport in those who may have been exposed, or certainly in those who we know did test positive for COVID. I think it's also important to know that athletes with disabilities, often do face unique barriers in their environment to access training, things like accessibility of training environments and specialized equipment. And some of those unique considerations, require being in a group training environment. And for that reason, it may take a little bit longer for those types of environments to totally reopen, and may create a little bit more delay for a para-athlete population. But certainly the goal should be the same, that we get people back to the resources that they need within a reasonable period of time. And then I'd say the last consideration is that there are some athletes with disabilities that really rely on hands-on support. So, for example, a visually impaired athlete with a guide runner, where that physical contact is actually part of competing and part of training. I think for those athletes, many of them have actually maintained contact with their guides and have been side by side with them because they were already in the same training environment. So it's almost like a family member. But others who may have been at home, and their guide in a different environment, obviously it'll take some time before they're able to have that close, intimate contact that's needed to train as an athlete with visual impairment, and that may create a little bit of extra delay. So those are, I think, some of the unique considerations for athletes with disabilities that we should keep in mind as we think about resumption of physical activity in sport.
A lot of people are coming out of lockdown and starting to become more and more active. Many been in hibernation for about a couple of months. When somebody coming out of hibernation and then suddenly increase their physical activity level, how does that affect para-athletes?
I think that there probably are some considerations related to, particularly athletes with disabilities that fall within the neuromuscular realm, where there probably are some considerations with regards to being a bit more cautious and taking time with return to play to avoid acute exacerbations of injury. So I'm thinking of, for example, of athletes with spasticity because of cerebral palsy or history of stroke or traumatic brain injury. We don't really know how alterations in an athlete's muscle tone and being in a period of relative rest because of having to be at home and social distancing, how that may impact their, baseline tone and therefore increased risk for return to sport. So, I don't know that we really have great data on that, but I do think that important to take into consideration for sure. And I'd also say that a lot of athletes who may have, underlying conditions like spasticity, a lot of athletes have also had challenges with accessing just their regular care. So, for example, seeing their typical rehabilitation doctor for spasticity management and spasticity treatment. And so the background disability may be in a little bit of a different place. And that, of course, should be optimized before then thinking about return to sport.
As you touched on before, not all para-athletes are the same. Not all para sports are the same. Can you give us some example of what is needed preparing to return into training?
There certainly are some sports where athletes are more likely to have underlying conditions that we really should be somewhat concerned about. I'd say, for example, boccia, which is a sport in the Paralympic movement. It's been a sport that's designed for athletes with high support needs. So, for example, athletes with fairly significant cerebral palsy. And those athletes probably do have, some amounts of restrictive pulmonary disease, some amounts of, underlying reduced pulmonary reserve where we really should be careful and probably be very cautious about bringing athletes out of precautions and into a normal public environment where they may be at higher risk of infection. It's hard to make sport-specific judgments. There are certainly sports, for example, like swimming, where we see more heterogeneity in the athlete population. And we see different conditions, and athletes with different conditions reach a fairly high level in sport. So, for example, underlying rheumatologic disease, where an athlete may be on immunomodulators or chronic immunosuppression. Athletes with history of cancer, where they may be on long-term immunosuppression to address, reduced risk of cancer recurrence. And so, it's just really important to know your athletes and to know their medical background, and then to create an individualized risk assessment for each athlete. Another thing that I think is important to understand and to take into consideration is the whole classification system. All athletes who are emerging elite or elite are required to undergo classification, and that's a very hands-on process. And over the past several months, pretty much all opportunities for classification internationally have been canceled. So a lot of athletes are feeling stressed because they may have missed their opportunity to be officially classified, and then are wondering, when will that resume? And when it does resume, how will it be done safely? And so we on the IPC Medical Committee are actually currently working on guidelines for infection control and classification that I think will be helpful moving forward to enable those opportunities to open back up. The last thing I'd say is that I do think that there, across the board in both an Olympic and Paralympic athlete population, really significant considerations to keep in mind regarding athlete mental health, and understanding that when we think about return to training in sport, some athletes may be ready and ready to get back out there and feeling very resilient and very eager to return, whereas others, may honestly be struggling either because of unexpected changes in their training and competition calendars, or because of underlying stressors that everyone is facing related to financial issues or family issues or childcare issues, or a number of things that, of course, impact everyone, including athletes. And so I think that when we think about readiness for return to play, we really, of course, need to think about both physical health, individual risk, but also not forget about mental health as well.
Yeah. You mentioned that para-athletes have pre-existing medical conditions. What is the best strategy to manage these pathologies and the red flags to consider when these athletes are re-engaging in sport?
I think the red flags are really probably the three groups that I previously mentioned. I think athletes with known reduced pulmonary function, certainly athletes with any amount of underlying cardiometabolic disease, and then any athletes with active immunosuppression, whether it's because of the disability itself or because of treatment for that disability. And I think anyone falling into those three categories, we should proceed with caution for sure. And certainly think about cardiac and pulmonary testing before returning to intensive sport. And also, inevitably, most of those athletes have a care, they're under the care of their home physician, their oncologist, for example, their rheumatologist, their pulmonologist. And I think it really has to be a team approach in which the sport physician has to work hand in hand with the athlete's primary care team to understand, ensuring that they're stable from a baseline standpoint before even thinking about sport. And I think that sports medicine physicians, say you're a team physician, for example, who's just getting to know the athlete, I think that could be a pretty tough situation, and probably will take a little bit more time to establish that team approach for those high-risk athletes.
How can we optimize or improve health in para-athlete population?
It's a great question. I think that one principle that's really important to keep in mind is that we shouldn't be overly alarmist or overly biased when we think about people with disabilities in general. I think it's really easy to cast everyone with a disability into like one category and to assume that it's going to be a dangerous situation and that we should, take extreme precautions for every individual. And frankly, as I've alluded to, that's just not the case. I mean, there's some individuals who really likely have no more risk than anyone else in the general athlete community. And so I think it's important to take a deep breath and relax a little bit and to be guided by the individual's health status and underlying health condition and to take that individual approach. And the other thing I'd say is that, we really need to work with the athletes themselves to raise awareness and understanding. It's sometimes shocking how little of this information actually gets to athletes. So, we can talk all day long about things like risk stratification and how to think about prevention, basic hygiene techniques, etc. Thinking about clearing an athlete for return to play. But it's so important that at some point we stop and pause and make sure that this information is getting to athletes. And I found that typically, probably for many reasons, I think predominantly often an issue related to, infrastructure and not having the same communication infrastructure in parasport. Often these messages aren't reaching our athletes. And, that's where it all starts. It starts with the athlete being empowered to know how to protect their own health. So I think we always have to come back to that basic principle about knowledge translation and athlete-friendly materials, whether it's via social media or email or print or any mechanism where we can reach them in order to empower them as an individual first and foremost.
In my experience, para-athletes are a pretty inspiring group of people. They're resilient, they embrace challenge, and they're very positive. We're all affected by COVID-19, and the biggest lesson I learned during this pandemic is embrace life and be okay with the unknown and the uncertainty. If there's one lesson you've learned during this period, what is it?
Yeah, those are pretty great principles. I'd say for me, I always go back to the word resilience. I think that although there are good days and bad days, and we all have days in which we feel pretty positive and other days where we struggle, that ultimately as a community we're resilient, and we will be back. I know that now it's hard to imagine a time where sport will totally return to normal, where there'll be packed stadiums, of 100,000 people watching a football match, but we will get there. I think it's hard to know when. Timelines are totally unclear, and that can feel uncomfortable, but I do think we'll be back. And keeping that optimistic approach and optimistic attitude, I think, is really important as we work through some of these day-to-day challenges.
On that note, we will wrap up this podcast. Thank you so much for joining us today, Cheri, and also special thanks to our audience. Stay safe and stay healthy, everybody.